Hello, welcome to my YouTube channel. My name is Annabelle Kawanda, a nurse from Zambia. If you're a returning subscriber, I said thank you so much for returning to this channel. And if you're a new subscriber, I said thank you so much for subscribing to my channel. Hope you're going to like the information you'll be getting from this channel. Without wasting your time, today we have a crucial topic, and this topic is nursing care plan. How to go about a nursing care plan, or how to write a nursing care plan when you're asked to write it in the exam or any test or in the words. So, without wasting your time, I'll just go direct into this topic. So, a nursing care plan, it's easy to get 50 out of 50 because it's a 50 mark question. So it's easy to get 50 out of 50, and it's easy to get a 0 out of 50. Yes, a 0 a 0 out of 50. So I've not really identified a condition, no, but I'm going to do a general nursing care plan. Like, I'll just do what you're supposed to write if you identify pain in your condition, or what you're supposed to do if you identify difficulty in breathing in that condition. So I'll just do a general nursing care plan. So let's go. Yes, so a nursing care plan. First, you have to write the heading, nursing care plan, and then you have to write the name of the patient. Whether it's an exam, they will give you the name of the patient. So write the name of the patient, the sex, and the age of that patient. So the next thing, there's a column. You know how to draw that column for nursing care plan. Then there's a date, there's a time, and then there's nursing, there's a problem, nursing diagnosis, and then there's objective or M. And then there's a column for intervention, stroke rationale, then there's evaluation, then there's signs somewhere there. So we are going to start. So given a condition where this patient is having difficulty in breathing, so our first problem will be altered breathing pattern. Altered breathing pattern is number one. Don't start with pain, don't start with fever. If that patient is also having difficulties in breathing, or altered breathing pattern should be your first one in that nursing care plan. Because if you start with nutrition, you start with hygiene, you start with fever, when this patient is failing to breathe, by the time you are going to finish managing all those things I've mentioned, then this patient could have died. So you prioritize by which one should come first and which one should come last. So altered breathing pattern is our first problem. So altered breathing pattern. Nursing diagnosis will be altered breathing pattern or dyspnea related to the patient condition evidenced by difficulty in breathing with the O2 saturating at 73. You guys, I know we've been taught on the normal ranges of oxygen level in the body is supposed to be 93 to 100. So anything below 93, then the patient is having difficulty in breathing in one way or the other. So altered breathing pattern, that's our problem. And then the nursing diagnosis is dyspnea related to patient's condition evidenced by difficulty in breathing with the O2 saturating at 73. I've just put 73 because it's less than 93. So our objective is to relieve dyspnea within 30 minutes of hospitalization. So you can relieve dyspnea within 30 minutes of hospitalization. Number two, it's our intervention. So we're going to relieve this dyspnea within 30 minutes of hospitalization. What are we going to do? So those are the intervention. So number one, we are going to open nearby windows to allow fresh air to come to this patient in relieving dyspnea. We are going to open nearby windows to allow fresh air to come in, thereby relieving dyspnea. Number 2, we are going to remove tight clothing in case this patient came with tight things. So we are going to loosen up or to remove tight clothes to promote lung expansion, thereby relieving dyspnea. Then number 3, we are going to give O2 therapy, which is 3 to 5 liters in adult, and in children it's supposed to be 1 to 3 liters per minute to relieve dyspnea. So evaluation, we are going to say dyspnea relieved evidenced by the patient breathing properly or the patient's O2 saturating at 93. You can put any figure from 93 to 100. So that is going to be your evaluation. So we are done with dyspnea. Our second problem will be pain. So when someone is in pain, a lot of things go wrong. Yes, so pain. So our second problem will be pain. So pain related to nursing diagnosis, pain related to patient's condition evidenced by patient verbalization or facial expression. So some patient will tell you to say, "Sister, I'm in pain." Others won't even say, though you will just see the facial expression to say this patient is in pain. So those two signs should be your evidence. Okay, yes. So our objective is to relieve pain. We want this patient not to be in pain, so to relieve pain. So nursing intervention stroke rationale will be: 1, you're going to assess the level of pain so that it will help you to choose the drugs to give the patient. Then you're going to position the patient in a very comfortable position to relieve pain. Then you are going to do diversional therapy. Yes, you can either do the play a radio, you can switch on the TV, you can give the patient the magazine to read, just to divert the mind from pain. Then fourthly, we are going to give an analgesic. Yes, we're going to give analgesic, which will be, the first line was going to be paracetamol 1 gram start, or if this patient in severe pain, we can give diclofenac and other analgesic drug. Then after we've put all those intervention, our evaluation will be pain relieved evidenced by patient verbalization. Yes, the patient will tell you to say, "Oh, I'm no longer in pain." Yes, so that will be our evaluation: pain relieved evidenced by the patient's verbalization. So away from pain, the other problem we can identify, it's going to be altered body temperature. Yes, altered body temperature, which is fever. Altered body temperature. So the normal ranges of fever, we know them, 36 to 37.2. So our problem is altered temperature, altered body temperature. Our nursing diagnosis will be fever related to patient's condition evidenced by raised temperature of 37.8 or 38 point something. Anything above 37.2, it's a raised fever. So our intervention we are going to do to open nearby windows to allow fresh air, thereby relieving fever. Then we are going to loosen up tight clothing to relieve fever. And then we are going to do tepid sponging. Yes, we're going to do tepid sponging to relieve fever. And then we are going to give antipyretics like paracetamol to relieve fever. So all these interventions is to relieve fever. Our nursing evaluation will be fever relieved evidenced by normal temperature, or fever relieved evidenced by the temperature of, if it was 38, then at least back to 36, somewhere there. So that is going to be our evaluation. Okay, away from fever, the other problem that we can identify can be dehydration. So if patients came with diarrhea, or in patients with cholera, and you're asked to write a nursing care plan, the other problem that you can identify is dehydration. So what you're going to write about dehydration, if you identify dehydration as your problem, the nursing diagnosis will be dehydration related to the patient's condition, evidenced by patient vomiting or having diarrhea. So dehydration related to patient's condition, evidenced by patient vomiting or having diarrhea or sweating a lot. All those can be your evidence, because this patient is losing water. That's why he or she is dehydrated. Yes. So your objective will be to rehydrate the patient within 30 minutes throughout hospitalization. So rehydrate the patient within 30 minutes and throughout hospitalization. So your intervention stroke rationale will be: one, we are going to give IV fluids, and our first fluid of choice will be Ringer's lactate. So Ringer's lactate and then normal saline. So we are going to give IV fluids to rehydrate the patient. We are going to give ORS to rehydrate the patient. Then we can also give oral fluids, which can be drink or super shake or any juice, just to rehydrate the patient. And then the evaluation will be patient rehydrated, evidenced by normal urine output, because the only way you can know that this patient is rehydrated is the urine output. So even on your intervention, you have to include the strict monitor of input of fluid and the output of urine. There you will know if your patient is rehydrated or still in dehydration. So your evaluation is going to be patient rehydrated, evidenced by normal urine output. Yeah, I think that will be the best. So another problem that you can identify, since we talked about the vomiting, I think nausea and vomiting, in some condition it can be a cardinal problem. So nausea and vomiting, your nursing diagnosis will be nausea and vomiting related to the patient's condition, evidenced by patient's verbalization and patient vomiting, because nausea is a symptom. So the patient would tell you to say, I'm nauseated, but vomiting is something that you're going to see. So nausea and vomiting, yes, nausea and vomiting related to patient's condition, evidenced by patient's vomiting and nauseated or verbalization. So your objectives will be to relieve nausea and vomiting within you can relieve nausea and vomiting within an hour or 30 minutes and throughout hospitalization. Your intervention will be, you give small frequent food, yes, to promote the appetite. Then prepare the food away from the patient to promote appetite. Then you can give antiemetics, yes, antiemetics to prevent vomiting. So those are the 3 interventions that you can do for nausea and vomiting. And then your evaluation will be nausea and vomiting relieved, evidenced by the patient not vomiting anymore, not vomiting and not nauseated. Excuse me. So your evaluation will be nausea and vomiting relieved, evidenced by the patient not vomiting or verbalization. Yes. So the other problem that you can identify is a risk. I think even risk of altered nutrition, in some condition, risk of altered nutrition can be a cardinal problem, and in some conditions it can be a risk, like I've put it in my general nursing care plan. So to me, I've put it as a risk of altered nutrition. So your nursing diagnosis will be risk of altered nutrition evidenced by patients loss of appetite, nausea and vomiting, and then loss of weight. So nausea and vomiting, loss of weight, and then loss of appetite can be your evidence in your risk of altered nutrition. So your objective is to prevent malnutrition. So what are you going to do to prevent this malnutrition which may occur in this patient? So now, nursing intervention number 1 will be to give small frequent food to promote appetite. Then we are going to prepare delicious, yummy, delicious food to promote appetite. And then we can also give some medications, yes, like mouthfeed to promote appetite. So your evaluation, please remember, a risk has no evidence when you are evaluating, because it has not happened. You are just preventing it to happen unless it's a cardinal problem. So our evaluation will be risk of altered nutrition prevented. If you want to say evidence by the patient, good appetite, or patient eating, that's on your problem, it shouldn't be a risk. So if altered nutrition was just a problem like that, then our evaluation will be altered nutrition prevented, evidenced by the patient eating normally or a patient's good appetite, that way. But since it's a risk, we are just going to say risk of altered nutrition prevented. I've got flu, sorry, it's not corona. And then the other problem that we can identify, we can also identify risk of infection. Risk of infection or nosocomial infection. So your nursing diagnosis will be risk of infection related to patient's hospitalization. So risk of infection related to patient's hospitalization, because this patient is in the hospital, so he or she is prone into a lot of other infections that can attack him. So your objectives will be to prevent infection. So your nursing interventions, your rationale, you do bed making to make sure where the patient is sleeping is clean to prevent infection. You're going to do damp dusting to prevent infection, and then we can also give some antibiotics. Yes, some antibiotics to prevent infection. Your evaluation will be infection prevented. Evidenced by what? You don't know the condition that this patient can. So it can be, if it was just infection, then the evidence can be infection prevented, evidenced by the patient not having any infection. But how do you know that? So it's better you put it as a risk, so that when you're evaluating, you can just say infection prevented. A risk has no evidence. So the other problem that you can identify, risk of pressure sore formation. Yes, so there are patients that are confined to bed and they are prone to pressure sore formation. So your nursing diagnosis will be risk of pressure sore formation related to the patient immobility. Yes, because this patient is not moving, then is prone to infection. Then your objective will be to prevent infection, to prevent pressure sore formation throughout hospital stay or hospitalization. Then your intervention, you're going to tend the patient every after 2 hours, and then you're going to do bed making. Yes, because when those wrinkles that are formed after you're sleeping on the bed can cause pressure sores. and then we are going to remove sewed linen from the patient bed to prevent pressure sore formation. Since it's a risk, the evaluation will be pressure sore prevented. So if this patient had pressure sores, you don't put it as a risk, but you just put it pressure sore formation. So your evaluation will be pressure sore formation or pressure sore formation prevented, evidenced by patient not having any pressure sores. So pressure sore formation, you can write it like that. I think for now those are fine. I think they are fine to write in an exam. Hope you've learned something. Hope you've gotten something. Hope you can remember if a nursing care plan can come in an exam. Those are the general conditions or general problems that you can write in each condition. So please just remember, if you can remember what I've taught you, try to remember what your tutors or your lecturers taught you. Please. So it's Sister Annabelle, a nurse from Zambia. Hope you've enjoyed my presentation. Don't forget to like it, subscribe, type comment if you have any question, if you need any clarity, and don't forget to invite others. I say peace and God bless you.